There is something about dementia that I wish more families understood before the diagnosis ever appears. Dementia does not always begin with a dramatic memory loss. Sometimes it begins with a change so small that nobody thinks it matters. A person who has always handled the household bills begins making unusual mistakes. Someone who has driven the same route for 20 years suddenly becomes uncomfortable behind the wheel. A spouse starts asking the same question repeatedly. A normally careful person becomes unusually impulsive with money. Or a person who has always been independent begins quietly avoiding activities that have become harder to manage. And because these changes can happen slowly, families often explain them away. They say, "That's just aging." But here's the problem. Normal aging and dementia are not the same thing. Occasionally forgetting a name, misplacing your glasses, or needing a little more time to remember something can happen as we get older. But when changes in memory, thinking, judgment, language, or everyday functioning become persistent and begin interfering with a person's usual life, doctors need to take a closer look. The National Institute on Aging specifically emphasizes that cognitive problems in older adults can have many causes. Some may be related to dementia, while others can come from medications, depression, metabolic problems, infections, sleep disturbances, or other medical conditions that may be treatable. That is why I don't want you to hear the word dementia and immediately become afraid. I want you to hear it and think, if something is changing, I should understand why. Because sometimes an early evaluation gives a family answers. Sometimes it reveals something treatable. And sometimes it identifies a condition early enough that the person and family have more time to make important decisions. Stay with me because later I'll explain what doctors wish families knew before the first diagnosis, why some symptoms are missed for years, and the simple steps you can take if you're beginning to notice changes. I'm a doctor, and I've spent more than 35 years caring for adults as they grow older. My goal here is not to frighten you or convince you that every forgotten name is a medical problem. My goal is to help you understand what doctors actually look for when someone over 60 begins experiencing changes in memory or thinking. And I want to start with a story. I'll call her Dorothy. Dorothy was 74 years old and lived in North Carolina. She had worked most of her life as an elementary school librarian. She was organized, independent, and extremely proud of the fact that she could take care of herself. After retirement, she enjoyed gardening, volunteering at her church, and having Sunday dinner with her daughter and grandchildren. For years, Dorothy managed her own finances. She knew exactly when the mortgage was due. She kept track of insurance payments. She organized her medications, and she rarely asked anyone for help. Then her daughter began noticing small changes. At first, Dorothy forgot an appointment. Nobody thought much about it. A few months later, she paid one bill twice. Again, the family didn't panic. Then she began asking her daughter questions she had already asked earlier that same day. Her daughter initially assumed Dorothy simply wasn't paying attention. But one afternoon, Dorothy called because she couldn't remember how to get to a store she had visited every week for years. That was different. Her daughter drove over. Dorothy was embarrassed. She said, "I don't know what's wrong with me. I know this place. I've been here hundreds of times." That sentence is something I want you to remember. I know this place, but something feels different. That is exactly the kind of statement that deserves attention. When Dorothy came in for an evaluation, we didn't immediately say, "This is dementia." Instead, we asked questions. When did the changes begin? Were they getting worse? How was she sleeping? What medications was she taking? How was her mood? Was she still managing her finances? Was she having trouble cooking? Was she getting lost? Was she having difficulty finding words? Had anyone noticed changes in her personality? That's how a proper evaluation begins, not with a label, with a pattern. And that brings us to the first truth I wish every family understood. Dementia is not one single disease. It is a general term describing problems with thinking and memory that interfere with everyday life. There are different types of dementia. Alzheimer's disease is one cause. Vascular dementia is another. There are also Lewy body dementia, frontotemporal disorders, and other causes. Sometimes more than one process contributes to a person's cognitive decline. The brain is complicated, and so are the conditions that affect it. That's why saying, "Mom is forgetting things, so she must have Alzheimer's," is not a medical diagnosis. Doctors need to investigate. The National Institute on Aging explains that doctors may evaluate memory, attention, language, problem solving, behavior, medical history, medications, and the person's ability to perform everyday activities. Blood or urine testing, brain imaging, and other tests may be used when appropriate to identify possible causes. Now let's talk about something that causes tremendous confusion: normal aging. As you get older, your brain changes. You may process information more slowly. You may need more time to retrieve a name. You may occasionally walk into a room and forget why you went there. You may put your keys somewhere unusual and have to search for them. Those experiences alone do not mean dementia. The important question is whether you eventually remember and whether you're still functioning normally. For example, forgetting where you placed your keys and finding them later is very different from repeatedly putting your keys somewhere and having no idea what they are for. Missing one monthly payment can happen to anyone. Developing persistent difficulty managing household bills is different. Forgetting what day it is and remembering after checking the calendar is different from repeatedly losing track of the date or season. The National Institute on Aging provides similar distinctions between occasional age-related forgetfulness and persistent problems that interfere with daily life. Most people don't realize how important that difference is. It's not simply about how much you forget. It's about how the changes affect your independence. And this brings us to one of the most important signs: difficulty managing familiar tasks. Imagine someone who has cooked the same meals for decades. They know exactly what ingredients to buy. They know how to prepare the food. They know which steps come first. Then gradually, something changes. They start forgetting ingredients. They become confused about the order of steps. They leave something cooking and forget about it. Or they suddenly cannot operate an appliance they've used for years. One incident doesn't establish dementia, but a persistent decline in familiar abilities deserves attention. That's because everyday activities require several brain systems working together: memory, attention, planning, sequencing, judgment, and problem solving. When those abilities begin to change, familiar routines can reveal the problem before a person realizes their memory is changing. And this is where family members often become important. The person experiencing the change may not notice it. The spouse may notice. An adult child may notice. A friend may notice. The National Institute on Aging specifically recommends taking cognitive concerns seriously when they come from either the patient or someone who knows the patient well. That doesn't mean the family member is always right. It means their observation is worth hearing. Now let's talk about financial decisions. This is one of the areas I wish families paid more attention to. Money management is cognitively demanding. You need memory, you need attention, you need judgment, you need planning, and you need the ability to recognize when something doesn't make sense. Suppose a person has always been financially careful. Suddenly they start making unusually large purchases. They begin sending money to strangers. They fall for suspicious phone calls. They forget recurring payments. They can't explain where money went. Again, one mistake does not mean dementia. Scams are becoming increasingly sophisticated, and anyone can be fooled. But a noticeable change from someone's established financial behavior can be an important clue. The National Institute on Aging notes that cognitive changes can sometimes first become apparent through problems involving financial management, safety, driving, and other complex daily activities. And this is why I encourage families to look at function rather than simply memory. Ask yourself, what can this person no longer do that they could easily do before? That question can be more informative than asking, did they forget someone's name? Now, another change that families sometimes overlook is getting lost or becoming confused in familiar surroundings. Everyone gets turned around occasionally. You may take a wrong exit, you may forget where you parked, you may walk into a store and temporarily lose your sense of direction. Those things happen. The concerning pattern is when familiar places begin to feel unfamiliar. A person takes a route they've driven for years and suddenly doesn't know where they are. They become confused about how to return home. They cannot explain where they have been. Or they repeatedly get lost in locations they previously knew extremely well. This can happen because navigation requires more than simple memory. Your brain builds an internal map using visual information, spatial relationships, attention, and memory. If those systems become impaired, familiar environments can become surprisingly difficult to navigate. The next point surprises many families. Dementia isn't always primarily about forgetting. Sometimes the earliest noticeable change involves judgment, sometimes language, sometimes planning, sometimes personality, sometimes visual spatial abilities. For example, a person may remember their daughter's name perfectly, but struggle to organize a complicated task. They may know where they live, but become unable to manage their finances. They may remember childhood events vividly, but struggle to follow a recipe. They may have a normal conversation, but become confused when asked to solve a practical problem. This is why dementia cannot be diagnosed simply by asking, "Do you remember what you ate yesterday?" Doctors look at multiple areas of cognition and, importantly, how those changes affect everyday life. Now, here's something else I want families to understand. Early diagnosis doesn't necessarily mean bad news. Sometimes people avoid evaluation because they think, if I don't get tested, I don't have to know. I understand that fear, but avoiding information doesn't necessarily protect you. If the problem is caused by something treatable, you want to know. If medication is contributing, you want to know. If depression is contributing, you want to know. If sleep problems are contributing, you want to know. If another medical condition is involved, you want to know. And if the evaluation does show a neurodegenerative condition, knowing earlier can give a person and family more time. The National Institute on Aging states that early assessment can help identify reversible or treatable causes, address safety concerns, manage medical conditions and medications, and help people plan for the future. That is a very different message from, go get tested because something terrible is coming. The message is, let's understand what's happening, and that's an important distinction. Now let's talk about mild cognitive impairment. You may have heard this term. Mild cognitive impairment, or MCI, means a person has more cognitive difficulty than expected for their age, but the changes do not significantly interfere with everyday independence. MCI is not the same thing as dementia. Some people with MCI eventually develop dementia. Others remain stable. Some can even improve, depending on the underlying cause. The National Institute on Aging emphasizes that identifying the cause of cognitive impairment is important because some contributors can be treated and because not everyone with MCI progresses to dementia. So if your doctor tells you that you have mild cognitive impairment, don't immediately assume the worst. Think of it as information. It tells you that something deserves monitoring, and that gives you an opportunity to investigate the cause and make appropriate decisions. Now I want to discuss one of the biggest mistakes families make. They wait for the problem to become obvious. They say, "We'll see what happens." Then 6 months pass, then another year. Then the person has trouble with driving, or finances, or medications, or cooking, or falls, or getting lost. By that point, the family may be dealing with a much more complicated situation. I'm not saying every memory concern requires an urgent specialist appointment, but persistent changes should not be ignored simply because they're uncomfortable to discuss. The earlier you understand what's happening, the more information you have, and information gives you options. Now let's talk about medications. Older adults often take several medications. Some prescription and over-the-counter medicines can affect alertness, concentration, or memory. That does not mean you should stop taking them. Please don't do that. Instead, ask your doctor or pharmacist to review everything you're taking. Bring prescription bottles, bring supplements, bring over-the-counter medications, bring sleep products, bring anything you take regularly. A medication review can sometimes uncover a contributor that might otherwise be missed. The same applies to sleep. Poor sleep can affect concentration and memory. Sleep apnea can contribute to daytime sleepiness and cognitive problems. Insomnia can leave people mentally exhausted. So if memory problems appear at the same time as major sleep changes, mention that. Mood matters too. Depression in an older adult does not always look like sadness. Sometimes it looks like withdrawal, loss of interest, low motivation, fatigue, poor concentration, and sometimes people describe it as, "My memory is terrible." That's another reason a proper evaluation matters. The National Institute on Aging lists depression, medication effects, metabolic and endocrine problems, infections, sleep disturbances, and other conditions among possible contributors to cognitive impairment. The next point is especially important. Do not assume that everything is dementia. And don't assume that nothing is dementia. Both extremes can be harmful. If you dismiss every change as aging, you may miss something important. If you interpret every forgotten name as dementia, you create unnecessary fear. The goal is somewhere in the middle. Pay attention, look for patterns, and get appropriate medical advice. So what should you actually do if you're concerned? Let's make this simple. Step 1 is to establish a baseline. Think about what you could do 1 or 2 years ago. Could you manage your finances? Could you organize your medications? Could you cook your normal meals? Could you drive familiar routes? Could you follow conversations? Could you use your phone or computer normally? Could you plan appointments? Could you shop independently? You're looking for changes in ability, not perfection. Step 2 is to write down specific examples. Don't simply tell your doctor, "My memory is bad." Write down what happened. I forgot an appointment even though I had written it on the calendar. I asked the same question 4 times. I got lost driving somewhere familiar. I paid the same bill twice. I couldn't follow a recipe I've made for years. Specific examples are much more useful. Step 3 is to bring someone who knows you well, if you're comfortable doing so. Sometimes the patient and family member notice different things. Both perspectives can be valuable. Step 4 is to ask for a complete medical review. Ask about medications, sleep, mood, hearing, vision, medical conditions, and whether cognitive testing is appropriate. Doctors have several ways to evaluate memory and thinking, and the appropriate approach depends on the individual. Step 5 is to protect the health factors you can control. Stay physically active within your abilities. Eat a balanced diet. Get adequate sleep. Stay socially connected. Keep chronic medical conditions appropriately managed. Continue activities that challenge your mind and give your life meaning. These steps cannot guarantee that you will never develop dementia. There is no magic food, supplement, exercise, or routine that can make that promise. Be very cautious of anyone selling you a product that claims to prevent Alzheimer's disease or reverse dementia. The National Institute on Aging specifically warns consumers to be cautious about unproven products marketed as memory enhancers or dementia prevention treatments. Now let's return to Dorothy. Her evaluation did not simply give the family a label, it gave them a clearer picture. They learned which abilities had changed. They learned which medical factors needed attention, and most importantly, they stopped arguing about whether Dorothy was just getting old. They started working with her. That changed everything. Her daughter became less frustrated, Dorothy became less embarrassed, and the family could begin making decisions based on information rather than fear. That's what I want for you, not fear, understanding. If you're watching this with a spouse, parent, or loved one, remember that confrontation rarely helps. Don't say, "You keep forgetting everything." Don't turn every conversation into a memory test. Instead, say something like, "I've noticed a few changes, and I'd like us to talk with your doctor about them." Protect their dignity. Let the doctor do the evaluation. And if you're the person noticing changes in yourself, don't be ashamed. Tell someone you trust. Make an appointment. Write down what you're experiencing. You are not admitting defeat. You're taking responsibility for your health. And there's one more thing I want you to remember. A dementia diagnosis does not erase the person. It doesn't erase their history. It doesn't erase their relationships. It doesn't erase their dignity. A person is still a person before, during, and after a diagnosis. The purpose of early evaluation is not simply to put a name on a problem. It is to understand what is happening and help the person live as well and as independently as possible. Research and clinical practice continue to change rapidly. Scientists are studying biomarkers, blood tests, imaging, genetics, lifestyle interventions, and new treatments that may help identify or treat Alzheimer's disease earlier. But many of these tools are still evolving, and not every test is appropriate for every person. That is why you should be careful with internet promises. If someone tells you they can diagnose dementia from one online quiz, be skeptical. If someone promises to reverse Alzheimer's with one supplement, be skeptical. If someone tells you that forgetting one person's name means you have dementia, be skeptical. Real medicine is more careful than that. It asks questions. It looks for patterns. It considers alternative explanations. It follows changes over time. And it treats the individual, not just the diagnosis. So tonight, I want you to ask yourself one question. Not, how many things have I forgotten? Instead, ask, has the way I function in everyday life changed? If the answer is no, that's reassuring. If the answer is yes, don't panic. Write down what you've noticed, talk to your doctor, bring someone you trust if appropriate, and investigate the cause. Because memory problems deserve understanding, not embarrassment, and dementia deserves neither denial nor fear. It deserves good medical care. If you're finding this helpful, let me know in the comments, and tell me where you're watching from. If you are concerned about yourself or someone you love, you can also share what change you noticed first. Sometimes one person's experience helps another family recognize something they have been quietly wondering about. And before we finish, I want to leave you with this. Getting older does not mean you are destined to develop dementia. Forgetting an occasional name does not mean you have Alzheimer's disease. Misplacing your glasses does not mean your brain is failing. But persistent changes in memory, judgment, language, orientation, or everyday abilities should not simply be dismissed as getting older. There is a difference between aging and disease, and finding that difference is exactly what a medical evaluation is for. So don't panic. Don't ignore it. Don't be ashamed to ask questions. Get the information you need. Because the earlier you understand what's happening, the more opportunities you may have to make informed decisions about your health, your independence, and your future. I'm a doctor, and if there's one thing I want every older adult and every family member to remember, it's this. You don't have to know what's wrong before you ask for help. You only have to notice that something has changed. If this video gave you a better understanding of dementia and healthy aging, consider subscribing for more calm, evidence-based health information for adults over 50. And my final question for you is this. What is one change in memory, behavior, or daily routine that you would want your doctor to know about? Share it in the comments. Take care of yourself, take care of the people you love, and remember that understanding your health is not something to fear. It is one of the most powerful things you can do for your future.